Somalia faced an unprecedented drought in 2022, one of the worst in the last 3 decades. The country was on the brink of a catastrophic famine as millions of people faced extreme levels of hunger and malnutrition. The conflict, enduring crisis, COVID-19 pandemic, insecurity in parts of the country, and a fragile and broken health system put millions of people at risk of dying.
I've been working in public health for close to 20 years now, and I have never seen a health crisis like the one that is unfolding in Somalia as we speak. Today, every single child, woman, and man in Somalia is facing hunger on a scale never seen since the 2011 famine.
1 out of every 7 children in Somalia is missing out life-saving vaccines as a result of displacement, as their families search for food. WHO responded to this crisis with an exceptional level of speed and strength. WHO was at the front line of this crisis. WHO deployed over 2,300 community health workers and over 350 community outreach teams and provided health care close to people in hard-to-reach marginalized communities, despite security concerns and a complex operating environment. WHO targeted 28 high-risk districts to provide essential health and nutrition services where the risk of starvation and death were high. WHO has so far reached nearly 7 million people, about 75% of the people who are in need, with life-saving treatments, essential health and nutrition interventions. WHO has supported 63 nutrition stabilization centers, 10 specialized cholera treatment centers, and 280 primary healthcare centers with supplies, medicines, and equipment to meet the surge demand for healthcare. Close to 4 million children have received additional doses of measles vaccines in 2022 to prevent a surge in measles cases. Over 2 million vulnerable people having low levels of immunity have received oral cholera vaccine as cholera cases were rising. WHO has raced against time to try to prevent major outbreaks diseases. Deaths and diseases thrive when hunger and food crises prolong.
1 out of every children in the country visits a health center with diseases which are largely preventable, such as measles, diarrheal diseases, cholera, and acute respiratory infections. We are racing against time to try to prevent diseases that are preventable. We have seen deaths and diseases thrive when hunger and food crises prolong. I have visited many places where drought is causing severe and dire situation. I have seen people have traveled miles after miles in search of food and water. Their weak bodies were not able to make it to that last mile to reach the health centers.
These millions of vulnerable people living in Somalia and trapped in poverty, conflict, hunger, and malnutrition, for no fault of them, were at the heart of WHO's work in 2022. Our results show that not only we have been able to push back famine, the catastrophic human tragedy of our lifetime, by working closely with other UN agencies and our partners, we have saved the lives of thousands, if not millions of lives in 2022, working in a complex and fragile environment. Our work in 2022 has been impactful, effective, and we're the lifeline for many of the people, children, and women served. Roughly 1.9 million susceptible children in Somalia have been immunized against measles. We have prevented a large measles outbreak of the size of 2017 measles outbreak in Somalia, one of the worst in history. A large-scale outbreak of cholera was averted in 2022, owing to our scaled-up efforts and deliver health services close to the people. WHO did not wait for a famine declaration to prevent people from dying. WHO acted and sustained its emergency health assistance to save lives and prevent deaths.
That we will see more people dying from diseases than from hunger and malnutrition combined. If we do not act now, the cost of our inaction will mean that children, women, and other vulnerable people will pay with their lives while we hopelessly and helplessly witness this tragedy unfold.
WHO did not wait for a famine declaration to prevent people from dying. WHO acted and sustained its emergency health assistance to save lives and prevent deaths. WHO will continue to support the Somali people trapped in the vicious cycle, humanitarian crisis conflict, and the climatic shock. The cost of our inaction will mean that children, women, and other vulnerable people will pay with their lives while we helplessly witness the human tragedy unfold in a country which is largely forgotten by the international community.